Anambra State government has commenced the process of operating drug revolving fund in general hospitals to make drugs readily available and at a cheaper rate. The Commissioner for Health, Anambra State, Dr. Afam Obidike, disclosed this while defending the 2022 revised budget estimate of the ministry before the Anambra State House of Assembly Committee on Health at the House of Assembly complex in Oka. House of Assembly correspondent Chukwema Kamodelim reports.
They at a cheaper rate, and we did pilot in 3 general hospitals.
Dr. Obidike emphasized that the project will also be extended to primary health care centers, and it will address the issue of drugs being out of stock as well as prevent maternal and infant mortality. The commissioner revealed that the present administration is recruiting health personnel to fill the gap created by lack of adequate human resources to meet the health needs of the people. He said that the state government has made provision for counterparts fund for partnership with World Health Organization, UNICEF, and other foreign donors in the area of health. He informed the committee that Soludo's administration has created Anambra State Health Facility Monitoring and Accreditation Agency to control health services coming from private hospitals with a view to eliminating quackery and ensuring that the lives of the people are safe.
Drug Revolving Fund is all about making drugs available at the right time and at a cheaper rate. And we did pilot in 3 general hospitals, and we expanded to 6 now. Now we're going to expand it into primary health care center as soon as we finish our employment of pharmacists before ending of this month. Now, what it means is this: issue of drugs out of stock will be, it may not totally remain, but it will be drastically controlled because we are working on it. That is essential medications, especially in prevention of maternal and infant mortality.
In the area of drug control, Dr. Obidike explained that the ministry has put in place drug quality insurance laboratory at Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amak, Oka, that must satisfy drugs worthy of consumption before they are sold in private pharmacies to safeguard the health of the people. Dr. Obidike assured that the issue of epileptic power supply in general hospitals and primary health centers will soon be a thing of the past as the state government is partnering with UNICEF to tackle it.
Some of our primary health care, they have solar, but the solar had issues. So what we're trying to do now, we are sending 4 persons on training that will now come and be permanently our engineers on repair of those solar. So anytime it has issue, it goes to fix it. Then in addition, UNICEF, as I'm talking to you now, have a lot of solars they have brought after in partnership with the state government. So we're going to have new solars installed inside some of those permanent health care areas. Then in terms of human resource for help, I mentioned it there. We are getting people recruited, and it's a process that will continue, because what we want to be doing is that as soon as somebody is leaving the system, probably it will be something that will be a continuous something. The governor, if you read the manifesto of the governor on human resource for help, our main agenda is there is to attract, retain, and train.
In his remarks, the chairman of Anambra State House of Assembly Committee on Health, Dr. Kata Umoduago, lauded the project of Soludo administration in the health sector, but urged Dr. Obidike to match his words with action by giving the expected result at the end of 2020 fiscal year. Dr. Umoduago assured that Anambra State House of Assembly will enact a law to compel all hospitals in the state to have drugs readily available in the interest of the state, even as he stressed the need for adequate funding of the health sector in the interest of the state.